want to mention that this year, on November 9th, 2010, our Fresno County Board of Supervisors proclaimed December 1st, 2010 as World AIDS Day in Fresno County. This item was sponsored by Supervisor Phil Larson, and it urged all citizens to take part in activities and observances designed to increase awareness and understanding of AIDS as a global challenge, to take part in AIDS prevention activities and programs, and to join the global effort to prevent transmission of the HIV virus and further spread of AIDS. This proclamation was signed by all the board members.
Short here. I'd like to introduce our guest speaker tonight, who is Dr. Tigis Haidu. Oh, that's on my chest. Dr. Haidu completed her BA in biochemistry and French at Canisius College in Buffalo, New York in 1886. I gotta say, she looks great for being that old. That's what it says here. I'm just reading off the script. In 1994, Dr. Haidu received her medical degree from the State University of Buffalo School of Medicine. In 1997, Dr. Haidu completed her family practice residency through the UC San Francisco Family Community Medicine Program in Fresno and worked in the HIV Special Services Department at University Medical Center for 4 years. Today, Dr. Haidu runs her own family practice, providing a full spectrum of care, including comprehensive HIV care. Her patient load includes approximately 125 HIV clients. Dr. Haidu is also the founder and president of the International Society for Better Health Access, a nonprofit organization that provides HIV/AIDS services in Ethiopia. Please have a round of applause for Dr. Haidu.
But I am really honored to be here tonight with everybody. I always sat in the back and I loved it. This is different. So I asked, what should I talk about? And I was told, no statistics, don't make it boring. And we're all bored. So let's see. I thought we would talk about why we did this World AIDS Day, December 1st. It is celebrated worldwide. And when it first started, do you guys remember 22 years ago? Okay, I'm old. 22 years ago. And it was really to do the quilts and commemorate everybody that had died. It was always in honor of the ones we lost. And really talking about a lot of the stigma and the treatment failures. And over the years, that had gotten better. So treatment-wise, who remembers AZT 4 to 6 times a day? Nobody. So the treatment was horrible. In 87, we had AZT. People had to take it and you're over the toilet bowl. About 4 years ago, we had Videx and chewable. And then we got about 5 drugs and we were all confused because you take one with food, one without food, one with fatty meals, one with no fat meal. So 2-3 times a day. So over the years, now we have over 26 medicines. We got HIV down, so we know how to control it. We don't know how to cure it yet. So people are doing fabulous. We're doing 1-a-day medicine, 2 tablets once a day. We're so picky about what you like, what makes me nauseated. So we're glad to say we have gotten quite a good handle on HIV, controlling the virus. So this year, the World AIDS organizers got together and they said, what should we focus on this World AIDS Day? So once a year, we celebrate for 24 hours. We commemorate on the ones that had passed. We talk about the treatment advances. So what should we talk about? So they picked 2 topics, universal health care, and what's the second topic? They just picked it last week, human rights. And so what does HIV have to do with human rights? So the point was, with the economy going bad, things have been cut, resources have been cut, we don't have any fundings, clinics are closing right and left, patients are going without medication. The assistance, the AIDS assistance program, ADAP, has cut down the medications we use. So now we want the media, the advocates, the patients, the families, all of us to go out there and promote HIV/AIDS funding and resources. And treatment is a right, a human right. So not having the treatment is really taking away the human right. So that's really the goal for this year, and that's what they're talking about worldwide today. So in Fresno, I would say I wanted to talk about what I have done, where I have come from. So we started when did they discover the HIV virus? 85? 81? And then the testing became nationwide. So I became a counselor, a 24-hour hotline, because I was in graduate school and it was wonderful. So I was on the phone. I learned a whole lot of sexual practices, because all the phone calls were, can you get it this way? Can you get it that way? So what does that mean? So we got a book published with all these practices. We're trying to figure out which one is the highest risk, the lower risk. We get down to mosquito bites. I don't know if you guys remember that. So we went from that. I finished medical school and I came here. So VMC didn't have special services. There was nothing dedicated to HIV/AIDS. And do you remember Sue Flaman? She's not here today. Dr. Lipke and Dr. Mortimer single-handedly decided they're going to be the pros taking care of HIV/AIDS. And they would come to the residents and they would say, you're taking care of this patient. And they say, with what? What do I do? So Sue ran around from clinic to clinic with charts and patients. And I was so discouraged because everybody I saw, except for 5 people, I lost. So when I was able to say, no, thank you, I said, I'm not touching it, I don't want it, leave me alone. So I felt really bad because Sue was there by herself and Dr. Mortimer. And then there were a few people, Joyce, and the single-handed lady in the back, Miss Carraker Cynthia, the only surviving private HIV/AIDS consulate of the town that we always call for PG&E and rights and everything else. She still does it. So I said, okay, if you guys teach me, I will do it. So they came up with the HIV specialty, so started doing the specialty. It's kind of so nice to see a disease from you are losing your people, your patients you love, and then everybody's kind of up and about, finishing school, going back to work. Now the psychosocial aspect we have a little trouble with, so we want to get a handle over that. So the drug treatment programs, the prevention part, we're not doing so great at. So we're hoping everybody gets together and promotes that we succeed in establishing more and more of those programs in Fresno. And if anybody can help the living room, Cynthia, All About Care, please do. We volunteers every day. I mean, if you're a patient, you can volunteer in many ways, and you do, most of you do. So, is that enough for Fresno and me? A little about Ethiopia. So since we got a good handle on, in America, taking care of HIV, we thought we should expand. This is World AIDS Day, so Ethiopia, because that's where I'm from. So we started going to Ethiopia. The second year, I didn't make a good impression, almost ended up in prison because I smuggled some AZT for the mothers, a Nevirapine, and it was not a legal drug at the time. So it has come a long way since then, and HIV/AIDS treatment is going around everywhere. So resistance is still taking on because they start sharing medicine. I feel so much better, let me give it to my neighbor. So the neighbor takes some and let me give it to his wife. So the resistance is the part we're having trouble in Africa. The HIV/AIDS, the rate, okay, I'm not supposed to talk about statistics, but even though on paper the rate doesn't seem to stagger going up, if you see the HIV/AIDS in African American women, it's really steadily going up. In African American men who are homosexual, it's steadily going up, but it's usually ages 16, 17, and the highest death rate is before age 45. So we haven't made any impact in that population. And we don't see everybody showing up to functions and programs because the stigma is still really out there. It's really out there, even in 2010. So working with the stigma would be amazing if we can infiltrate the population where the HIV/AIDS, the rate is going higher. So the younger kids, all I have to say is we keep saying we're doing so great with treatment. HIV is a chronic disease. You can live with it. You can lead a normal life. So that scare factor is gone. So the younger kids have forgotten about protection because we don't promote it anymore. So let's promote the prevention so we can control the disease. Even though we can take care of it, it's better to prevent it. We still don't know how to cure the disease.